Arthritis.
Hi, Mr. Arthritis. So I spoke with the doctor. We are going to be discharging you today, so I'm going to go over your discharge instructions with you. Can you go ahead and confirm your name and date of birth for me?
Arthritis.
And what's your date of birth?
3/24/30.
Great, thank you so much. And I see your granddaughter is present. Is it okay if I discuss your discharge instructions while she's present?
As long as you don't talk about my hemorrhoids.
Okay, that's fair. So I have a lot to cover with you. So you came here to us at Daytona State Hospital on March 27th, 2020 for a total knee arthroplasty due to osteoarthritis of your right knee, resulting in degenerative joint disorder. Your medical history was also significant with type 2 diabetes mellitus, though this present diagnosis is controlled via diet, right?
Yes.
Okay, great. So you were taking Celebrex 100 milligrams twice daily?
Yes.
Okay, and then you were also taking Motrin and Aleve for pain management, right?
Yes.
Okay. So how often were you taking those?
Twice a day.
Okay, great. Thank you so much. So the doctor does want you to continue the Celebrex as prescribed, and he's going to give you a 7-day supply of Ketorolac, which will be a medication for pain management. And this is the same medication that the nurses have been giving you for pain management. So you can take 30 milligrams every 4 to 6 hours for this, for pain management. And I have it highlighted on your discharge instructions and have the prescription for here for you to take to the pharmacy. So you'll have 7 days worth of medication. Just be mindful not to start any new medications without consulting with your doctor first.
Yes.
And there's always a risk of a risk with this medication, and this medication will be taking. There could be a risk for bleeding. So we just want to be monitoring that. If you notice any excessive bleeding or increase in bleeding from the incision site. Some common reactions may be headache, nausea, vomiting, abdominal pain, dizziness, and possibly constipation. Mobility overall does decrease your risk for constipation because this kind of slows down the GI movement. So you want to encourage range of motion exercises, which the physical therapist has been doing with you, and you will continue physical therapy at home. And I've also got those physical therapy exercises here for you in your discharge instructions. I also want you to make sure you're just drinking plenty of fluids, at least 2 to 3 liters per day, and that's going to also kind of help prevent any of that constipation, and will help with the healing process. You have your orders to continue physical therapy outpatient at the Daytona State Rehab Center, and that'll be 3 times a week for 45 minutes. And I also did highlight that for you in your discharge instructions as well. So you're not being discharged with complicated wound care, but you will need to ensure that your incision site does not become compromised. Just make sure you monitor for any signs of infection, redness, warmth, swelling. You want to look at the drainage, the color of it, excessive drainage. If you start having a fever, any increased tenderness at the incision site. Also, if you start having nausea, vomiting, dizziness, any pain or excessive swelling in the leg, and any shortness of breath, and any kind of strange odor or color of the drainage that's coming from the incision site. So your orthopedic doctor has a follow-up appointment scheduled with you in 3 days, and I highlighted the date and time in your discharge instructions. Do you or your granddaughter have any questions for me?
No, I do not.
All right, great. Well, it's been a pleasure taking care of you, and on behalf of Daytona State Hospital, I would like to wish you a speedy recovery. Your granddaughter can go ahead and go collect the car, and I see all of your belongings have been packed, and you look all ready to go. So I'll have our CNA Agatha help you out to the car.
Thank you.
Thank you so much.
Oh my